It's my pleasure and privilege to welcome you again, Mr. Kagan.
It's mutual.
It's always a pleasure. So what's the topic today?
Today I think we have to talk about schizophrenia. Of all topics we decided to choose today because on one hand people don't want to talk about it, but on another hand, unfortunately, a lot of patients suffer from it and a lot of families deal with it, and they're not eager to talk about it in public, and a lot of miscommunication and a lot of theories, I was shocked to learn that you sent me some info, and I was shocked to learn that schizophrenia is not just affecting our brain, not our brain, but the brain of patients, of people, but also other parts of the body, or could be completely opposite way. First it affects the body organs and then the brain. So it's a total surprise for me. How to explain this?
Well, first of all, schizophrenia, it's a modern term, because before it was just called dementia praecox. It means that the dementia, that's early dementia, that's the translation, what it is.
And dementia is very common
dementia.
diagnosis.
So basically what I was ever referring to is that something is if it goes wrong with the patient, because dementia does not necessarily mean delusions or something like that. It's just something wrong. And dementia praecox, that's the old name of the schizophrenia. And yeah, it's just basically, in my understanding, it was actually, this term was referring to some kind of, not necessarily the delusions or delirium or something like that, when something's wrong with patient's mind.
Dementia is associated in most of the people's minds is some issues with lapses of memory, but not with schizophrenia. On the opposite hand, is associated usually with much more severe psychological problems.
Well, not necessarily, because for example, one of my first encounters with a schizophrenic patient was the young guy who came to see me, and he asked me a very simple question. He asked, "Doc, why I don't have emotions? Other people can love, can experience love, can experience joy, sadness. I don't. What's wrong with me?"
And what did you answer?
No, I knew the story. I knew that he was schizophrenic, but that's the only thing he had. That's it. No emotions.
So it's not like he was going nuts completely.
No, of course
not. Completely opposite.
No, and
from what you say.
Let me.
So he was calmed down, just talking about lack of emotions.
Right. That's the only thing. Let me give you another example. A woman came to see me. And said, "Doc, you know what, I'm not going to talk about myself today, I'm going to talk about my husband."
Okay.
I married him, it's a very loving husband, everything was alright, but I found his records, and actually it was his diary. And when she showed me what he wrote, it was complete nonsense. It's just the words without any sense.
And it scared her.
She realized that he was schizophrenic, even though there was no symptoms whatsoever. He was a loving husband, everything was good. And she didn't even know about that.
For how long?
She found,
for a few days, few weeks?
Nobody knows. No,
few months, few
they
years?
were married for a few years. But she
only after a few years she noticed that he's...
No, she didn't notice anything, just she found his notes. That's it.
So it's a lot of stereotyping going around.
Of course, that's
about this disease.
That's simple as you might think. It's not necessarily delirium. It's some kind of deviations in behavioral, in patient's behavior. And one of the first, bells when I heard about that something is very interesting about schizophrenia is that there was a interesting case. I think it was in Japan. And it was the patient with schizophrenia was hospitalized, and he was in acute stage, and he developed pneumonia.
Okay.
And what that did? What's they're doing when somebody has pneumonia? Give antibiotics, right?
Correct.
But guess what happened? Not only pneumonia improved, but his mental condition improved. So they were started thinking, just maybe it's not that simple. Maybe it's just bacterial infection that can cause his mental symptoms. And that's why they were just digging. Unfortunately, it didn't result in any significant breakthrough. But let me put it this way. How many nutritional actually deficiencies can cause dementia? And in fact, a lot. How about vitamin B12?
You like this
B12?
You like this vitamin?
Dementia. How about vitamin B3, niacin? Dementia too. How about if somebody supposedly comes to emergency room with altered mental status, he is agitated, etc., what they're going to give him? Vitamin B1 thiamine, because they're suspecting the delirium secondary to alcohol withdrawal. So basically what I'm driving at, that a lot of nutritional deficiencies can cause change in our behavior.
So you're saying if people have a wrong diet, they eat something like, they don't have enough certain vitamins, like some malnutrition? I don't know.
No, it's not necessarily what they eat. In fact, that's very hard nowadays to develop vitamin deficiencies secondary to not eating, unless there is a patient is an alcoholic and eats canned food only. But if somebody goes to the store and eats regular food, it's kind of very hard. But it's not that hard as you might think.
But then how do you develop like lack of B12 vitamin, for example?
No, B12 is kind of complicated stuff, but the rest, it's
fruits and vegetables, I know.
Let me give you a very simple example.
Yeah.
Supposedly somebody somebody wants to lose his weight.
Okay.
And he was told that the carbohydrates are kind of very dangerous and he needs to use artificial sweeteners to reduce his calorie intake. Okay. Sounds familiar, right?
Yes, very familiar.
Guess what happens?
He could develop diabetes even.
No. We are talking about vitamins right now. Let's talk about vitamins.
Okay.
Let's just concentrate on that. So, supposedly somebody, this particular guy wanted to start taking artificial sweeteners. And guess what happens? Artificial sweeteners start to interfere with carbohydrates intake and digestion and absorption, and carbohydrates start accumulating in the digestive tract, creating malabsorption. And if you check guidelines, just official guidelines, if a patient comes with malabsorption, what are we supposed to check first for what? For artificial sweeteners intake. So supposedly somebody is taking artificial sweeteners, develop malabsorption. What happens to his vitamins? It's not a rocket science to assume.
Going down.
It's going to go down, right? But actually, it's a little bit more complicated than you might think. And today, when I talk about breakthrough in psychiatry, actually, I don't think everybody knows about that. I don't think that it was just advertised or it was kind of they're talking about a lot on the radio. No. But the fundamental research found very interesting thing. That before we talk about that, just a little bit excursus in psychiatry. So basically, you know that our emotions, our thoughts are mediated by mediators, by neurotransmitters, right? It's like serotonin, gamma-aminobutyric acid, dopamine, adrenaline. That's what basically makes us happy, unhappy, or create fear, etc., etc. That's basic transmitters. So in order to feel those transmitters, we need to have receptors, right?
Okay.
Guess what they found? They found that our body can develop autoantibodies to those receptors. So what basically it means? If somehow our body develops antibodies to certain receptors, to certain neurotransmitter, the function of neurotransmitter is severely altered.
And person doesn't feel what's going on, like in a certain way.
Yeah.
You know?
Yeah, supposedly somebody has autoantibodies to dopamine. I don't think this guy has any motivation.
That's what this patient you were talking about.
I don't know if he had it or not, but it's quite possible. And that was basically the basic research. It's changed everything. So basically a lot of psychiatric conditions now can be explained by very simple things. Autoimmune disorder. And as you know, that autoimmune disorder has little to do with brain itself.
By the way, so does it mean that you're saying someone who regularly replaces regular sugar with sweeteners, that's not a smart move, you know? Like
No, it's not, but that's one part of the story.
small, tiny part.
It's
yeah.
one part, not necessarily, because every guy, every patient has his own history. What I'm driving at, that the more information we gain, the more information we have, that's not actually brain, it's what's below the neck. That's what really matters.
Correct, because everybody assumes that schizophrenia is like all about brain activities and like everything related to your brain, you know, like, and what you're saying, it could be what you eat, it could be how your body, like you just mentioned, like special cells or special fights, special, you know, like, so like it's everything in combination.
Right, but basically that's what it is, and just blame, to blame brain itself for everything, I don't think it's right. I don't think it's right. I don't think we have to blame one of the most complicated, most sophisticated, most precious part of our body. Why do we have to blame that the brain doesn't do it?
But
No.
it was assumption that it's the only reason why people have this schizophrenia is because their brain doesn't function
Well,
properly.
it's like, you know, let's kill the messenger. You know, that's basically the same
Yes.
thing. But I don't think it's a smart move. Okay, and basically, if we are talking about autoimmune disorder, immune disorders, if we can say that psychiatric illnesses are can be explained by autoimmune disorders, so we need to look for something which is going into the digestive tract. Why is that? It's very simple, because 70% of the immune system is located in the digestive system. That's as simple as that.
You always, I notice in almost every disease, it's coming back to the digestive system and immune system and of course nutrition, you know, like almost all the
Not
time.
not necessarily, because if we are talking about psychiatric issues, a lot of problems are created by heavy metals. Heavy metals like mercury, and this is a very common thing. That's what we see in our practice. Lead is a little bit less than that. Yeah, but these toxins play a very significant role in our. Let's talk about that, because what we are trying to do is to change our mood with something simple. Like, you know, the best-selling products in grocery is mood modifiers. It's sweets, cigarettes, alcohol, and cigarettes. No, wait a second. Sweets, cigarettes, alcohol, and tobacco. Yes.
And coffee.
And coffee, right.
Yeah?
Yes.
I was joking.
Yeah, just because that's caffeine, right. Basically, that's what mood modifiers, that's the best sellers. Because what we are trying to do, just it's very easy, instead of just making our life better, just why don't I get a bottle of, I don't know, whiskey or whatever you drink, and just that's it. You don't need to work that much. And that's very important, because, what we are trying to do and we are inclined to do is to just make it simple. If you want to be happy, yeah, it's just in front of you. Just smoke the cigarettes, sweets, coffee. That's easy. But I don't think that's right. I don't think, because personally I don't drink alcohol, and you know that.
Yeah, you told me.
I'm guilty. Sometimes I drink coffee. Yes, I do, but kind of very rare. Unless it's really necessary. So I'm trying not to influence my mood, but some kind of artificial stuff, like, So, but what we are talking about is...
What about sweeteners? You don't use?
No. That's not what we do.
Okay.
Because artificial sweeteners, that's one of the most debated things, because artificial sweeteners or aspartame were linked to a lot of complications, and as far as I remember, if I'm not mistaken, aspartame actually is prohibited for the US pilots, military pilots, to take, because it...
But why FDA approved it? Why FDA will not just ban it forever? If it's so dangerous.
If you talk about FDA, just do me a favor, go to the internet and Google very simple search. The drugs that were removed from circulation, and you see how many drugs were approved by FDA and then removed from circulation.
Wow.
So basically, if FDA approves something, it doesn't really, tell us that much.
Got it.
It doesn't tell us if it's safe. It doesn't tell us if it's effective. Nothing.
It's not a guarantee.
No,
Okay.
no. It's not only guaranteed, not even close to this. Not even close, because if we discussed before that the effectiveness of psychotropic antidepressants.
Yes.
And it is highly debatable, because I don't think there is any credible documentation or any credible studies that prove that they are really effective. You remember I told you about the tale about the priest and the poor man? They're the same thing. But that's how they work, and it actually explains why antidepressants do not work the same day or next day. In order to get their effect, you need about 3 weeks to 1 month. And it perfectly fits in explanation I gave you.
But let's come back to the discussion about schizophrenia.
Mm-hmm.
So you're saying that it's obviously you're saying that we need to be careful with what we eat, and also diagnosis sometimes, like it's very important if person coming to you saying I have this issues or that issue, to come to the bottom, to, like you like to say, to the roots of the problem, to prescribe a proper treatment.
That is kind of complicated. The reason for that is because if there is a problem like simple, like vitamin deficiencies,
Yeah.
yes, we can fix it relatively simple. Yeah, let me give you an example. A lady came to see me with irregular heartbeats. It's very interesting example.
Okay.
Irregular heartbeats, and her heart was failing, and she was offered the heart solution, like amazing procedure in New York Presbyterian Hospital.
Okay.
So cardiologist said that if you don't do it, you need to write a will very soon. Okay, so and she came to see me, and she was kind of desperate, and we did the blood work, and we found that she was lacking B12. So I started giving her B12. Guess what happened to her irregular heartbeats?
It's normal.
Disappeared. She went back to cardiologist. That's what happened. And she went to cardiologist, and cardiologist checked her cardiogram, and she said, "You don't need the amazing procedure anymore." No, but what I'm trying to tell you, that sometimes very simple solutions can solve very complicated problems. Okay, and I didn't expect that.
But you need a professional doctor. B, you need like proper diagnosis, proper testing, before coming to this conclusion, what should be prescribed.
That's a little bit...
It's not just simple blood analysis, you know more than
very
that.
simple. Let me tell you something, that actually in a very simple blood work, we can see a lot of things.
So why other doctors often miss it, like this cardiologist you're talking about, I'm sure she gave her blood test before.
Well, I don't have an answer. I don't know.
You were not the first person whom she gave blood analysis, I guarantee you.
But let me give you an example how it's really, when I was working in the hospital and I was having resonance, and one of the morning rounds we were talking about methylation. So I started telling them that methylation is very important. Methylation is kind of repair mechanism. So, and the residents were listening to me and said, "Doc, but how do we know what's going on with our methylation?" And I said, "But look, you're checking methylation, patient's methylation every day." And they said, "Really? How?" And I said that, "Aren't you looking at the CBC, like complete white cell count, complete blood count?" They said, "Yes, but how we can figure out methylation based on that?" It's very simple, by the erythrocyte size.
I don't know what is it.
Do you know red blood cells?
Yes.
So red blood cells is called erythrocyte.
Okay.
Right? So by the size of the erythrocyte, it's very easy. If the size of erythrocyte is normal, methylation is relatively okay. But if the size of erythrocyte goes up, then there is a problem with methylation. It just can be seen in a regular, just very simple blood test they do every day, complete blood count. You need to look for it, that's all.
It reminds me sometimes people think, oh, it's so easy for you to have a TV show. It's so easy for you, like you're talking on the radio. It's so easy to write a story, you know, like it's easy because I have a huge experience, because I have education, because I practiced it over and over again. So now it became easier for me. Same story here. It looks like you think it's easy, but many other people look at it and do not see it, you know.
Can I respectfully disagree with you? I think that you are very good, not only because you have a huge experience, because you have a personality.
Okay, thank you.
That's why your brain works. I'm telling you honestly, because you can have tons of experience if you don't apply, if you don't make sense out of your experience. Forget it. But how are you going to benefit from it?
Yes, but with blood analysis, I don't think doctor needs to have a lot of charismatic personality. The doctor should have a knowledge, experience, practice, and to know exactly about even size of blood cells. You know, like that's not about personality. That's about knowledge and experience. At least in your case.
I don't know what to tell you, but my guess is this. Somehow, we try to look for something very complicated and miss something that's just in front of our nose, just in front of our face. And we look for complicated stuff like, something, like amazing procedure without basic electrolytes. Basic electrolytes, basically vitamins. And somehow people tend to look for something complicated that they're missing, for something like, like how much this patient has calcium, magnesium, vitamin D, this basic stuff.
Potassium,
potassium.
All the time.
Yeah, potassium, of course, potassium. Potassium, it is very important. And that, I don't know, it's the bias or I just don't have an explanation why. But that's the fact, because I saw it so many times when we were talking about with residents. They were trying to look for something complicated without noticing that the solution is very simple, just in front of them. So make it simple. KISS principle, KISS. KISS. Yes. Keep it simple, stupid. The same thing is here. Keep it simple, stupid.
Okay. Coming back to your experience with patients with schizophrenia or dementia, I know it's different things, but still, so you recommend them vitamins, or you cannot say generalize. Every person will look for the root cause.
We look for the root cause. Sometimes we are successful, and sometimes we are not. And here is the reason: because if the problem is lack of vitamins, that, as I said, we can fix it relatively easily, or somebody has sky-high mercury levels. Yeah, this patient can be chelated, it's no problem, feels better. After chelation therapy, can concentrate, work as prior.
You mentioned lead, which could be found even in the paint in some buildings. That's what you
lead, but mostly it's mercury. Mercury is very well known. You know,
in the seafood,
Alice
in the seafood, where do you find mercury?
Just Alice in Wonderworld.
Yes.
You remember a guy, Mad Hatter?
Yes, okay.
That is the classic description of mercury toxicity. You know why? No? Because at that time, the hats, they were soaked with the solution containing mercury. So who were making headers, that they almost everybody had mercury toxicity. That's the picture of the mercury toxicity. And we have everything. So we have a lot of toxins around. So a patient comes, and we already know those patients. And they come and we are saying, "What's your favorite food?"
Yeah, and they say shrimp.
Sushi.
So because sushi is like usually raw stuff, so.
There was actually a movie, I think $1 Million Baby, and the main character, it was a lady, Hilary Swank. Okay, so she, as soon as she started, she was supposed to lose some weight. Okay, and in order to do that, she corrected her diet, but after changing her diet, he became very sick. That's a very well-known story. And the doctor was very smart, so he checked her mercury level, and it was sky high. That's very well known. Just you can find it.
And he asked what to eat.
Yeah, and he said because in order to lose weight, she switched to seafood, and that's why she got mercury.
But it doesn't mean all seafood has so much mercury. We do not want to tell our viewers no seafood, be careful.
It's not about
I know you
seafood
like
itself.
fish a lot, correct?
Yes, I do. But basically, that's very simple. The less the size, the less mercury you have.
Mhm.
It's very simple. You know, the most dangerous. It's one of the most dangerous king mackerel, like tuna, something big, really big. The small fish is relatively safe, like catfish, trout. Okay, the small like shrimps or.
What about the red snapper?
Red snapper is kind of in between, but I wouldn't suggest eating red snapper that is big. As soon as it's small, you're okay. You know why? Because that's very simple. Because the elimination system in a fish body is very underdeveloped. It's not like ours, so it cannot remove mercury. So mercury tends to accumulate in the fish body. So as soon as
What about salmon, the most popular fish in America, salmon?
Salmon, what I eat personally, wild Alaskan salmon, that's the only salmon I eat. And I tend to get the small size. So as soon as you get small fish, you know, you're
Most
relatively
expensive
okay.
Alaskan salmon, okay.
Well, but you don't have any choice. Because if you don't pay that price, you will have to pay
What about
for.
shrimps?
No, I don't think that shrimp is
Oysters probably have mercury. Oysters.
Not to my knowledge, small, no, certainly.
Because they're small.
Very
But
small.
why size matters? I don't understand.
That's because I said. Because see, what happens is, in order to get really dangerous, fish need to accumulate. And it's predator fish, mostly predator fish. So supposedly, which fish is dangerous? That eats smaller fish which is already accumulated mercury. And that's how it happens.
So the bigger the fish, the bigger the problem.
Right. And basically the fish that eats plantain is relatively kind of on the safe side. That's why trout is okay, catfish is okay, but not okay the predator fish like tuna that eats other fish or salmon. Okay, but it has to be big size. If it's small, it doesn't have enough time to accumulate mercury.
So big fish and big seafood is quite risky in terms of mercury, correct?
Yeah, but you can check the FDA recommendations, and you will find out that pregnant women are not supposed to eat fish like more than 3 or 2 times a week. I don't remember exactly, but something like that. It's very well known thing. Just I don't think
Not
anybody looks for
everybody,
this.
okay.
You know, but that's what they recommend. Just pregnant women, they cannot eat fish because of mercury.
I've heard only that it's a good thing to eat fish because it's good for your brain, for phosphorus and stuff like this.
I don't think it's for phosphorus itself. I think it's about omega-3. You know, there is a theory how actually the
People will be even smarter if they eat fish.
human being was created. I don't know if it's true or not, but it's kind of telltale. So,
Okay.
you know, I tell you about the monkey on the beach? No.
No monkey on the beach?
Monkey, yeah, there was in prehistoric times. So the monkey was sitting on the beach, and it was a very smart monkey. Saw a fish and decided to try it. And as soon as it grabbed it and ate it, became a human being. Yeah, that's because of the omega-3 fatty acids.
So
That's the theory.
So it's not a fairy tale then.
I don't think it's a fairy tale. But listen, who knows what exactly happened?
Yes, of
but
course.
it's one of the explanations how a monkey became a human being. It's because they started wow, why human beings? It just everything started near the sea. It's because of that.
Okay, what about liquid? Like we talked about food, what about liquid? Like I know that you're a big fan of
If
water.
you're talking about alcohol,
No, water. I know you're a big fan of water.
Yeah, but it's just water is very important too. But you need to make sure there's not enough. That's not that much water. You can't even imagine how many people come to the hospital with intoxication of water intoxication.
And they drink just regular water?
Yeah.
Why
They
intoxication?
become very sick, like they can develop seizures.
Why?
Why? Look, supposedly somebody, as I said, developed antibodies with the receptor of water intake. So receptors stop working properly because of the antibodies, as I said. And the person does not realize that he drank already enough water, and he drinks again and again and again. And the thirst, he cannot. You know, the thirst.
Constantly thirst.
Can you overcome it? No. and they drink water from everywhere, from the toilets, from wherever they can. No, I'm telling you. And what happens is that their sodium goes too down because of the dilution, and they have altered mental status. They stop understanding what's going on, and finally just develop seizures. Yeah, people don't realize that everything good is good in moderation. Water, yes, water is good, but just make sure that you're drinking appropriate amount.
Should be enough water, but not too much water. Everything should be in moderation.
Not too little, not too much water, and that's pretty much it. So basically about our success. So
Yes.
if the problem is relatively simple, yes, we can help, and the result is quite fast. If there is a problem with autoimmune disorder, it's not that fast. Okay, so basically, if antibodies there are autoantibody, or the process has started, it's extremely difficult and sometimes even impossible to turn it back. What is lost is lost. You know, you can't reverse what happened, what already happened.
Most of the patients who come into you with schizophrenia, are they like old people, like middle-aged people, or you even can see younger people with this disease?
We do not see schizophrenics every day. And the reason for that is very simple. If somebody has dementia like this, they do not realize that they're sick.
Correct.
And that's why they don't seek our attention.
But eventually they...
No, eventually they don't, because they don't understand that they're sick. And what happens is that sometimes when we have some kind of patient like that, we can treat mild cases, because of the patient's compliance. There's a lot of supposedly parents bring their son or daughter and say, hey, help.
Or husband or wife.
Husband or wife, probably not, but you know, this most common is parents.
Parents.
Parents coming, yeah, and I usually or children bring their parents.
Parents. Okay.
And I said that how are we going to make sure that they're compliant? There's no way, no way. This I think relatively there was.
You mean they take proper medicine, lifestyle, etc.?
Yeah, lifestyle, food, and everything. They cannot be controlled. How can you control them? There's no way. Yeah, there are some success. Yeah, but that, you remember the last case that was very successful was that, but the son was really with his mother all the time. All the time. And that's how it worked. Yeah, it was very tough.
Because like you have work responsibilities, you have families, etc.
When he was going to work, his wife was there, and that's how they solved the problem. But other than that, no, that was very successful because mother started feeling better. But so basically, that's pretty much it. So if it's much better to prevent, but who's going to prevent it if they think that psychiatric diseases are related to brain? Nobody's going to think about their belly, not brain.
Correct. Again, people assume, at least I assumed till like a few days ago, till I started to talk to you about this issue, that it's all about brain damage, brain problems, etc.
No, don't.
But now I see it's all interconnected with everything, you know, even digestion issues.
Yeah, so basically when autoimmune process has started, well, to reverse it, I'm not sure that it's always possible. You know, I wouldn't be that desperate, but you know, the prognosis is much worse if we suspect that it's autoimmune stuff. But that's pretty much it, I guess.
Thank you very much again. I'm amazed by your depth of experience, knowledge, and examples, and it's very non-traditional approaches. You can see, because we're not like looking at face what is traditional, and in this office and with this doctor, you always have to expect that he looks at all possible options, trying to learn from like various doctors and various theories, and to come up with his own solutions, how to solve, how to resolve all of these issues.
Basically what I'm talking about is everything is in mainstream literature. It's just you need to look for it. That's all. Okay. So next time we'll look for something else.
Okay, thank you very much.
Thank you.
I appreciate it. Thank you.
All right.